Good evening, everyone, and welcome to a presentation by myself, Dr. Abraham Thomas from Collaborative Medical Education. I'm honored to be bringing this subject to you today, and our presentation is titled Mind Over Matter, a Guide to Enhancing Memory for General Practitioners. I'm Dr. Abraham Thomas, a general practitioner based in Peterborough in the UK, and I started a collaborative medical education project, a peer support network for various GP trainees and fully qualified GPs to start talking to each other, teaching each other about important topics in primary care. It started off as a goal to help people to pass exams, and we've expanded to include many other topics as well. So today we're very pleased to be bringing you this lecture or webinar on memory. So without further ado, let's get started. So let's talk about memory types and processes. Our aims and objectives of this presentation itself is to describe different types of memory, such as sensory, short-term, working, and long-term memory, and their functions and characteristics. We're going to explain how information is encoded, stored, and retrieved, and we'll explore the factors that influence these processes, such as attention, rehearsal, organization, and retrieval. We're also going to discuss the role of working memory as temporary storage and a manipulation system that supports higher cognitive processes, such as reasoning, problem solving, and decision making. On the right here, you will see all of the anatomy of the brain that's involved in forming our memories and taking in the senses. I'm not going to go through this in great detail. It's familiar to most of us, but particular importance is the hippocampus, of course, the amygdala, the entorhinal cortex, and of course, your dorsolateral prefrontal cortex, as well as lateral orbitofrontal cortex. Obviously, all of this is used in conjunction with your frontal lobe, which forms the higher cognitive processes that we, as the most evolved mammals on this planet, are able to utilize. So what are the types of memories that we have, and how are these memories stored? So we have sensory memories, short-term memory, working memory, and long-term memory. And if we go through some of the anatomy and the physiology that's involved in this, the frontal lobe stores somatic and episodic memories. And if we come down to this picture over here, we'll see that information comes in via sensory memory, which just lasts about a fraction of a second, and then goes into our short-term memory, which lasts a little longer, less than a minute. And then this information we collect into a long-term memory, which is meant to be endless. And we'll talk about techniques later on in the presentation to enhance your memory. So long-term memory can be divided into explicit memory and implicit memory. We're going to go through this in more detail in a bit. And under declarative memory, we have episodic memory and semantic memory. So the frontal lobe, it stores semantic and episodic memories. Then we have the motor cortex, which involves in storing procedural memories more. The cerebellum, obviously a very important role in storage of procedural memories. Hippocampus is really, really important in terms of forming a long-term memory, as well as the subdivisions of semantic and episodic. The amygdala, as we know, is heavily involved in our emotional regulation and is vital for formation of new emotional memories. Our temporal lobe is involved in the formation and storage of long-term semantic and episodic memories and contributes to the processing of new material in short-term memory. Very relevant there. Prefrontal cortex is involved in storage of short-term memory. And then we go around the circuit once again. Moving on to sensory memory. So sensory memory, of course, it relates to our five senses and how we receive stimuli from around the world. So they can be divided, of course, into haptic, touch, echoic, sound, iconic, vision, olfactory, smell, and gustatory, taste. So sensory memory in psychology refers to short-term retention of sensory information immediately following stimuli input. It's a very crucial stage that briefly stores vast amounts of sensory data before it's selectively filtered into conscious awareness as working memory. It is possible to permanently register. It's not possible, pardon me, to permanently register every impression we have captured by these senses. But attention is the first step in remembering something. And if a person's attention is focused on one of the sensory stores, data is transferred to short-term memory, further processed, and encoded into long-term storage. Unlike sensory memory, which merely stores raw sensory input, and this bit is quite important, short-term memory interprets and assigns meaning to these stimuli, allowing us to understand and respond to our environment. And we're going to be talking about encoding in a little bit more detail. Encoding in working memory can also facilitate the transfer of information to long-term memory for more permanent storage. So what are some of the techniques we can use to improve our short-term memory? So our short-term memory is also known as primary or active memory. And like we said, it's a brief period of time, usually a few seconds to a minute. It only has a limited capacity. And quite a historical study here points out that we can only hold on to a small amount of information at a time. 7 items plus or minus 2 is usually the golden rule. Short-term memories involve tasks that require immediate attention recall, such as remembering a phone number or a list of words. I'm not going to go into great detail with the different parts of the anatomy of the brain and how that affects your short-term memory. It's all here on the screen for you guys to take your time and look at. Next, we have encoding. And encoding in short-term memory involves a transient representation of information, usually based on the sensory attributes of the input. And this is how encoding works for short-term memory. So acoustic encoding. This is the most common form of encoding. Information, especially verbal information, is often stored based on its sound. That's when we're trying to remember a phone number, we might repeat it out loud or hear it in your mind, your inner voice. Visual encoding. Visual encoding is a process of storing visual images. For example, if you glance at a picture briefly, and then try to recall details about it a few moments later, you rely on your visual encoding. Semantic encoding, on the other hand, involves processing the meaning of information, although it plays a more dominant role in long-term memory encoding. There are short-term tasks where meaning can influence memory, like remembering words that form a coherent sentence versus a random list of facts. And these bits of information are really important to understand how memory works and how we can improve it, particularly if we want to learn large sums of information, for example, for our exams or just for our daily practice. And lastly, we have tactile encoding, where information can be encoded based on touch, though it's a lot less common than acoustic or visual. Next, we'll be talking about working memory. And we've got this great illustration from Simple Psychology, thank you very much, where we talk about these components, right? So working memory theories assume that complex reasoning and learning tasks require a mental workspace to hold and manipulate the information. Think of it as the RAM of your computer, not your hard drive, where your random access memory, which has very finite amount of memory compared to, of course, the hard drive, which is more akin to your long-term memory. Working memory is a multi-component system and includes the central executive, which is the conductor of the brain, this gentleman right here in the middle, the visual spatial sketchpad, also known as your inner eye, your phonological loop, which is your inner voice, and lastly, your episodic buffer, which is not illustrated in this picture, but it integrates the information and links your working memory to your long-term memory. Why is working memory important? It's important for reasoning, learning, and comprehension. And it acts as a bridge between short-term and long-term memory, and also as a control system that regulates the flow of and manipulation of information in the mind. Long-term memory. So it's not a single story, it's divided into two halves. Explicit, okay, which we have here, also known as declarative. It's when we're knowing that. And implicit long-term memory, it's knowing how. So those are the two big branches there. That's how we break it up. So we can break this up further into procedural and emotional conditioning, but procedural skills and actions, let's talk about that, is a part of the implicit long-term memory responsible for knowing how to do things. Like, for example, the memory of motor skills. It does not involve conscious thought and is non-declarative. So, for example, is how we learn to write about it, or how we can access that information. Semantic memory, on the other hand, is part of the explicit long-term memory responsible for storing information about the world. Includes knowledge about the meaning of words as well as general knowledge. For example, knowing that London is the capital of England involves conscious thought and is declarative. Episodic memory is a part of the explicit long-term memory responsible for storing information about events, specific episodes in time that we have experienced in our lives. Involves conscious thought and is declarative. An example would be a memory of our first day of school. And I'm sure we all have memories just as important as that. So here are some examples of memory and learning disorders. Apologies for the quite wordy slide. I'm not going to go through all of it, but Alzheimer's disease, for example, mainly affects long-term memory, especially episodic memory. Some people with Alzheimer's have difficulty forming new long-term memories and recalling past ones. They may also have problems with semantic memory, the memory of facts and concepts, for example, and impairments in working memory and short-term memory, particularly as the disease progresses. Vascular dementia, on the other hand, is a kind of dementia caused by reduced blood flow to the brain, for example, from cardiovascular disease or strokes, etc. It affects different types of memory depending on location and extent of the brain damage, of course. Some people have more issues with short-term memory and working memory, while others have problems with long-term. It can also cause other sort of cognitive and behavioral changes, impaired executive function, for example, attention, language, mood. And other examples we can use are traumatic brain injury and strokes, which affect memory in various ways, completely based on where the extent of the brain damage or brain injury has occurred. Some people with TBI experience post-traumatic amnesia, which is a loss of memories just before or after the event, while others might have problems with short-term and working memory. Long-term memory, of course, can be affected, particularly if the injury has occurred to the hippocampus itself. And as we know, unfortunately, stroke patients have issues with short-term working, long-term memory, but also affect their executive function, attention, language, and mood. Similarly, we'll all be aware of developmental disabilities, where there are a group of conditions that can affect the development of the brain and the central nervous system, and peripheral, of course, such as intellectual disability conditions, autism spectrum disorder, Down syndrome, fetal alcohol syndrome, among so many others. Now, these can affect everything from your short-term working memory that involves remembering instructions, following directions, and completing tasks. Others might have more problems with long-term memory, such as learning new information, recalling facts, or generalizing skills. It can also affect other cognitive and behavioral domains, such as intelligence, communication, socialization, and emotion. And obviously, understanding how complex all of these systems are is part of the learning that we're doing in our day-to-day lives. So let's talk about some techniques to enhance your memory. We have a plethora of techniques, and after looking at multiple sources, I found that the most comprehensive one was from Daniel Wong, who teaches A-level students, I believe, on how they can pass the exams, but he's got this amazing article that I've stolen a lot from, so thank you very much, Daniel Wong. So first things first, use images as much as possible. The human brain processes images faster than words, okay? 90% of our information of our brain process is visual. And it's interesting to me that if we process visual information 60,000 times faster than words. So obviously we remember images a lot better than words. So I've got some examples here. This is from medcomic.com, and you can find a lot of illustrations. And I found these particularly useful for my exams. But it's very interesting to me. This one picture can really resonate in your mind and fixate. So here we've got the major and minor Jones criteria for diagnosis, and they're very cleverly highlighted different text here in different colors compared to the minor criteria. But again, illustrated picture. Again, Graves' disease. I love this little picture that they've illustrated, a little comic with Gary Goiter over there, rest in peace. And most common cause of hyperthyroidism, of course, is mentioned here. Tachycardia, arrhythmias, exophthalmos, diaphoresis, tremors, loose stools. And this visual technique obviously lends itself perfectly to help you remember lots of different facts that might or might not be interconnected, but might be part of a disease process. Here we have another example that I had to learn from my exam, the toxicity bear, and something that's quite complicated to remember all these drug side effects, but you can see how this artist has illustrated in different colors the different parts of the bear and its anatomy that's been affected by all of these drugs. Next, we have matching information with sounds or letters. So sometimes words sound the same or similar spelling, and we can sort of create a mental scaffolding by adjusting and putting these things together, right? So I had to learn all these antibodies, for example, for our exam, and what conditions, of course, they're when they're tested for, or when you're suspecting them, that you would request these tests. And I've created these group of sort of quick aid memoirs, if you will. So you can see that I've compared the first letter here, crest and centimere. Sjogren's and Rolla seem to fit together quite well for me. Again, autoimmune hepatitis, I try to think of a way to remember KLM. I thought of the airlines, the flying, and they serve alcohol, which leads to cirrhosis. And that's how I've linked that autoimmune hepatitis to the KLM, the anti-KLM. Again, systemic sclerosis, you can see how I have highlighted different letters within these words so that I remember them more easily. And of course, one of the techniques is using colors a lot in your revision notes. And again, similarly with cirrhosis and cholangitis, mitochondrial, using these little techniques to kind of match everything up. Next, we talk about using acronyms and mnemonics, a technique that we're all very familiar with from medical school. So here on the right, I wanted to learn which were the live vaccines compared to the ones that weren't live. And so I came up with this mnemonic: baby Romans, BCG, yellow fever, rotavirus, oral typhoid, MMR, nasal flu, and shingles, chickenpox. So you can see I've matched up a couple of these features. I've ignored a couple of letters here, but it's very easy to remember something like baby Romans compared to remembering that all of these vaccines are actually live. Again, cranial nerve functions, we all would have a mnemonic to remember all the cranial nerves. So instead, I'll include here the mnemonic that I choose to remember if a particular cranial nerve is sensory, motor, or both. And I particularly like this mnemonic that they use. So some say marry money, but my brother says big brains matter most. And again, you will be all familiar with other mnemonics, and some of them might be more easy to remember because we use, for example, funny language or something that's silly. I've even come across a lot of mnemonics that are what we would classify as slightly dirty language. And again, whatever technique works for you, it's about resonating and connecting these things to make it most memorable in your mind. Next, we have the technique of creating a story, and this is a very effective memory technique. A lot of us will use this automatically when we think about a particular condition and we have a certain patient in mind. Perhaps it was an emergency situation, maybe it was emotionally fraught, maybe there were other elements that really made it stand out in your memory compared to all the other patients that you're faced with that condition before. Maybe it was your first. So creating a story and seeing a narrative helps to, again, fixate those cognitive processes and your memory with a narrative. Okay, so here they've used example of trying to memorize equals MC square. You can use a visual memory of imagining an elephant walking towards a monkey that's holding a square-shaped cracker. And if you drew that out, of course, after you came up with that story, you would be reinforcing even more sort of cognitive processes that relate to memory. This one seems very, very obvious. So connect the information to something you already know well. And research shows, of course, that it's easier to learn something new if you can link it to something you already understand. So it's really important for us to think about mental scaffolding and think about processes that are similar enough that they have parallels that help you remember things. Here they use an example of learning about electricity, compare electricity to water. And they have an analogy here, which isn't a perfect analogy, but it can help you to learn concepts related to electricity just a little bit faster. And particularly when I learned A-level biology, a lot of these techniques was used where, the more common things that a 15-year-old would know, and it was related to biological processes of, for example, photosynthesis or meiosis or other cellular processes in pathophysiology. Studying in different locations, I thought this was a really interesting one. So this is almost dispelling a myth, if you will. Many people will tell you to do all your studying in one place, but this makes you feel that you'll be more effective and follow a habit and a technique, a routine. But research shows that this isn't always the best way to do things. So they described this experiment that they created, but they felt that different settings create more mental scaffolding that you can hang the new material on. Take advantage of this effect, try changing your studying environment. Do some of the studying at home, some at school, some at the library, and maybe other memorable places around your town. And maybe you can find a way to relate your environment to the topic that you're studying and help fixate it. However, they have found for this technique to work, you need to be studying the same material in different locations, which is not always easy, but something that potentially could work quite well for you yourselves. Next, going to sleep after learning something challenging is something that are found to be very, very effective, and apparently something that top students do. Research showed the students who went to sleep within a few hours of learning session were better able to remember what they just learned. Okay. And again, I'm not going to go into too much detail, but if you look into the science of dreaming and why we spend so long dreaming and what parts of our brains are active when we dream, you will recognize actually and learn that quite a few cognitive processes are reinforced in our mind while we're dreaming. For example, our visuospatial cortex is very, very active when we're dreaming. One of the reasons they think this might be is from an evolutionary biology point of view. The first time you come across, let's say, a new technique, a new way to spear a buffalo in the wild, when you then go to sleep, which is, of course, let's not forget, a third of our lives, because we spend ideally 8 hours sleeping. Of course, that doesn't work quite well when you're doing an on-call shift overnight, as most of us know as doctors. But when we dream and we're using our visual cortex, sometimes we run through that same memory, let's say spearing the buffalo in the wilds, many times in our mind. And this is a way for our brain to remember and reinforce knowledge that is new. Another thing is because we spend a third of our lives sort of sleeping and not using our visual senses, this is another way to keep that area of our brain very, very active. There are many other theories as well about why we dream and how we convert sort of short-term memory into longer-term memory when we sleep, particularly during REM sleep. And it's a fascinating area of study that is still in its infancy, if I understand correctly. Next, other techniques, going for a walk before trying to memorize information. Of course, we know exercise has an amazing effect on the brain in a positive way. Saying the information out loud can be something that's a really, really effective technique. Information that we have read aloud to ourselves compared to information we only read silently make a huge difference. And again, this might not be easy in a quiet library, but again, when we're rehearsing and recalling our information, it's quite effective to do this out loud. And if you remember back to your childhoods, how we used to remember a lot of things, our parents would say, please go to the shop and buy these 3 items for us. And we would say, okay, yes, I've got that right. And your mom or dad would say to you, well, tell me again, tell me exactly what those 3 items are. And you would say sort of 2, and then you're a bit slow, and then they repeat. And, that's how they do things, really. But it's a very obvious technique to use and one that's really, really effective. So speak your information out loud to help reinforce those cognitive processes. Next, this is, for me, a very interesting sort of concept. It relates to rote learning. And if you don't know what rote learning is where you memorize something without actually understanding the information. And it's a very common mistake, and certainly it's a huge part of, I would say, my early education, where rote learning was pretty much the gold standard of how we passed exams and how we got through tests and all the rest of it. But it seems to be the research doesn't support it being particularly useful. It's more difficult to memorize content when there's no context there. And of course, there's no context if we're just memorizing something verbatim without actually analyzing the information and understanding it effectively. And we Therefore, don't create any mental pegs onto which to hang the new information. And again, this concept of mental scaffolding keeps on coming back, and it's about creating that robustness. And I know a lot of you might be thinking about the memory palace, and we'll be coming to that in a moment. Obviously, this is a very clear a technique that works very, very well, teaching other people what you've learned. Obviously, you study something, and our motto for our collaborative medical education is learn, teach, repeat ad infinitum. Because we never stop learning, and the more we teach, the more we learn. Okay. So this, again, reinforces that type, and another slide there. Using colors, you can see that I've highlighted information here. So colors capture our attention. Like we said before, brain processes visual input, such as color, 60,000 times faster than text. It allows your brain to pre-process the information, which I thought was really interesting. So some really useful tips is color code after you're taking notes, not while you're taking notes, because that interrupts this process, interrupts the flow of the study session, and it's easy to sort of overdo things and sort of almost get into the nitty-gritty too much in the details, whereas you might want to start off with big overarching themes, trying to understand where you can, and then reinforce that with spaced repetition, revisiting that information at a set interval, let's say 3 days time, a week's time, a month's time, and going over that same material over and over again to reinforce our memory and converting more of that information into long-term memory. This I thought was quite interesting. So using consistent color code across all subjects and topics would be really useful. So for example, when I did exam questions for my AKT exam, I used to use the color code. I would get a question wrong and I would highlight it in red, for example, maybe just the title. If it was something I knew very well, I would go for green. But amber would be where I've gotten something right, but I'm not confident enough the next time I see that question that I'll get 100% right. So it's an amber zone. Conversely, something where I should know this a little bit better, but I've guessed wrong, I would probably put an amber category. So using that technique, I was able to see what kind of topics feel that I'm more on the green, amber, or red on, you know? And again, I subdivided the questions and the kind of topics. So under respiratory, for example, interstitial lung disease might not have been something I was very good at, and I would categorize it accordingly. And this would help me when I'm looking back in that information many months later to see, okay, how did I feel about this topic before? And now that I've tested myself, have I improved that? Am I going towards the green category in all the areas that I want to learn? Next, writing out information you want to memorize. This one is a very obvious one, and one that certainly a lot of us use. We like to, write things down from textbooks, from blackboards, from computers, laptops. And of course, with the digital age, we're maybe writing things less and we're typing things out more, but maybe there are other new novel ways to think about using this in our cognitive memory processes. This one seems more obvious. Draw tables and diagrams, of course. So presenting the same information in a new form. So tables, diagrams, mind maps. Those are things that I particularly didn't use a lot of in med school. And now I'm finding it's a really good visual tool to, particularly when there's a big project and you have to think about multiple elements, to stop subdividing that in your mind and having an idea and then splitting it off and then recategorizing things. And now we have amazing software that we can use to mind map all sorts of concepts. And again, moving things around digitally makes it a lot easier to get that flow of information correct in our minds. Again, you use a couple of examples here, and they point out that it helps us remember concepts faster as compared to just trying to memorize a chunk of text. This bit was really interesting. Use hard to read fonts, and you've seen throughout this presentation, I've used things that maybe aren't consistent with a classic visual style of presentation. It's because I would like every single one of these slides to stand out in your memory as individual ones rather than meld all into one. You notice that even though I'm using two pictures in a lot of my slides, I rarely position them in exactly the same way in the screen. Again, trying to prompt your visual cortex to categorize this or compartmentalize this as separate bits of information rather than one and the same. However, I'm using similar themes here because, again, to create a better mental scaffolding, so you're able to connect those bits of information that are interconnected but aren't necessarily overlapping with each other, if you see what I mean. Next, we have memory lists with rhyming pegs word system. So this relates to a lot of our rhymes from when we were children. So 1, 2, buckle my shoe, 3, 4, close the door, shut the door, however you want to say it. There's a reason why we learn a lot of nursery rhymes when we were children, because again, that rhyming pattern hence helps us reinforce our memory a lot more. And now we come to the memory palace. I'm sure a lot of people thought that this would be mentioned pretty early on. And again, I've learned something that it's been attributed to the Greek poet Simonides. I'm not sure if I'm pronouncing that right. But it was said, and there are multiple sort of accounts and different versions of the story, but essentially it was attending a dinner when the building suddenly collapsed and he was the only survivor. However, the bodies were crushed beyond recognition. However, he was able to use his visual memory of the dinner itself to think about where each person was sitting in that room and help to identify bodies that way. And that's how he realized, of course, this is an amazing technique that we can use to memorize all kinds of information. You might have heard of famous characters use this. The one that comes to mind for me is Hannibal, of course, from Silence of the Lambs, and he uses a memory technique and is written as a character who has eidetic or photographic memory. Next, we have practicing active recall. I obviously mentioned spaced repetition. So active recall is also known as the testing effect. This is a tendency for your memory to improve when you devote some time, some of your learning to retrieving the information in an active way. It's very different from passive recall. In passive recall, we're learning by reading notes, listening to audio, watching a video about a science concept, just like this. But in contrast, in active recall, you practice retrieving the information. So say you're watching this in the morning, at night, just try and think of some of the things that this presentation has taught you, for example, and that will really help reinforce what you're doing more active recall at that point. Try and teach someone about it, and you're having to use active recall as well as other techniques, and that reinforcing is even stronger. A lot of us have made flashcards, of course, and here is a technique for getting the most out of the flashcards. We're not going to go through that in great detail today. And of course, you know about chunking, memory chunking. This is a quite important technique. So if I give you this this set of letters without the spacing in between, it would be a lot harder to sort of memorize them. However, if you categorize them into animals, companies, alphabets, split them up into sort of triplets, that makes the learning a lot easier. And they use some examples here about how to learn a guitar tune, for example, or phonics. And lastly, and this is obviously brings us full circle to the beginning of the presentation, really, when we talked about your working memory and your sensory memory, for example, but use as many of your senses as possible. And again, it helps us, the more memories we have, the more senses, pardon me, we stimulate, the easier it is to encode those memories using, again, all of those elements of your sensory memory that we talked about to begin with. And again, they feel that this is one of the bases of the renowned Montessori method, which I'm told Jeff Bezos learned in school. So that's pretty much it. Thank you very much for listening to my presentation. And if there are any queries, feel free to get in touch with me at collaborativemedicaleducation@gmail.com. It's been a pleasure. I hope you've learned something today, and I hope I've helped in your professional life in my tiny way. Thank you. Have a good day.